We saw a lot of interesting data on CDK4/6 inhibitors at ASCO 2018. Probably one of the highlights was the MONALEESA-3 study, which completed our picture of phase 3 studies in the early metastatic as well as the later metastatic setting. So I think people probably tend to use these agents more once they get approved worldwide. And we saw data in the discussion hinting at the fact that it may be beneficial to use them already in the first line setting, because at the end of the day you buy the patients more time without chemotherapy. We have 3 CDK4/6 inhibitors that are approved in the US, and will soon all 3 be approved in Europe as well. And I think there are some differences with regard to safety. We saw this at this year's ASCO as well. There's 2 of them are more hematological side effects. Abemaciclib has more GI side effects. But I think at the end of the day, the efficacy is very, very similar. So probably physicians and patients will choose for what they have most experience with. I think we have to rethink metastatic breast cancer, particularly in the hormone receptor positive setting, because we now have such long times when patients are on therapy that we have to pay much more attention to quality of life and also adherence to the drug intake than we used to do. And I think we're not so much equipped, so we need better supportive staff as well in order to take patients through these long journeys where they are on oral therapies and don't have any disease progression. We've seen a lot of very interesting early phase 1/2 studies at ASCO this year with regard to immunotherapy, PARP inhibitors, and also antibody drug conjugates. And I'm very sure that some of these agents will make it into phase 3 and eventually make it into the clinic. So I think we're living in a very exciting time. I think my personal highlights in the metastatic breast cancer session at ASCO 2018 was, first of all, the MONALEESA-3 study, which sort of complemented nicely our array of other phase 3 studies. And I don't think we've ever had in breast cancer a molecule where we had 3 different drugs from 3 different companies, which such consistent efficacy and safety data. That was one of the highlights. And I think the other highlight was sort of the outlook, looking at new treatment options. And there were 2 AKT inhibitors that were presented this year at ASCO, one from AstraZeneca and the LOTUS trial. And I think both of these drugs, who also gave an overall survival advantage, will be used in further clinical trials and hopefully make it into clinical practice.